your seat. Anytime, Marty.
Okay.
Marker. Up, marker.
And Alfreda, I want you to, if you would chat with me and tell me a little bit about how you came to be at Neighborcare.
If I told you how I came to be at Neighborcare, this might sound crazy, okay? But I believe I've been coming to Neighborcare since I was 9 years old. And I say that because I can remember at 9, lying on my mother's lap in the emergency room and hearing the staff there ask her multiple times, how is this going to be paid for? And I was lying there kind of going in and out of consciousness, thinking something's wrong with this. And I wasn't sure what all that felt like to my mother, but I know now that her dignity had to have been diminished at that point. And I knew then that something had to be wrong with that and something's got to be better. So I've always known that I wanted to be in healthcare and help my neighbors. So thus, Neighborcare, this is the place for me.
I came to Seattle and Dr. Scott's office manager was out for the evening and walked by me and I was panhandling. And she turned around and came back and gave me a bus ticket and a card and said, come here tomorrow and we'll help you. And that was almost 16 years ago. I went to 45th Street Clinic the next day and Dr. Scott took care of me and my boyfriend who had trench foot. And by the end of the day, we weren't hungry. We had resources in hand. And we had been medically stabilized for the moment with promises of ongoing care. 16 years later, that ongoing care is still here. Oh, dude, I'm sorry.
It's really about something that lives in the hearts of our staff and is transferred to embrace patients, meeting them where they are and being on a journey with them to improve their health.
Cultural diversity is not really just appreciated, but it's celebrated, and that everyone can really be themselves and express their culture through their language, through their attire.
And it's something that many patients have shared with me, that they are really grateful to be known by name, not by a number.
Sí, yo me siento bien, me siento afortunado por la sencilla razón de que
I feel good, I feel fortunate.
tengo mis achaques, tengo mis problemas, a quien acudir.
That when I have my problems and my physical issues, that I have someone I can rely on.
A big part of our strategy as an organization is to really fully embrace the concept of being a respectful healthcare home. And the word home is a very, very sacred word in our language.
My patients, who if I've helped them have their babies, they bring their babies here to be cared for throughout their whole life by our nurse practitioners, by our family doctors, by our dentists. So I see my families grow up, and that's a home.
When I got out of the Army, what I wasn't diagnosed with was PTSD. If I had not had a healthcare provider that would give me, I guess you can say, like first line defense for both my physical and my emotional problems, I would be with some friends that I served with, which have committed suicide. And Dr. Dodd really did. He was really that last line. He was there when I needed him. And without that kind of provider, without that kind of giver, I did not have enough belief in myself that I mattered.
That happens day in and day out with a lot of hard work from a lot of people, from the people at the front desk, the patient services representatives, to the medical assistants, to the dental assistants, to the dentists, to the nurse practitioners.
And we've watched here at Neighborcare Health more than 13,000 people enrolled for the first time, many of them for the first time in health insurance. It is a magical time for Neighborcare Health. We have such an amazing team of people. This organization is on a roll. We are growing. We have opportunities almost more than we can handle, but people are up for it, they're up to it, and they're handling it. It's just an amazing time.